Okay, queer scar care, and today we're going to be talking about castor oil packing. So now you ran into this in massage school.
Yep.
And I learned about this through somatic sex education and Ellen Heed's work, and then also with my your scar training care with Marjorie Brooke. So we're going to walk through kind of how to with castor oil packing. So you need castor oil. It's very viscous. It's almost like a simple syrup.
Yeah, it's a bit sticky.
Very sticky, yeah, very thick. So you need so little. You can always apply more. But
it's gonna last for ages.
Yeah, this little bottle, I give clients, I give a bottle and I give like half full and it lasts as long as they need. I've not had somebody need to refill it yet.
Yeah.
So, and it's beans, so it's vegan, so that's great. And it really penetrates the skin. One of the biggest things with scar tissue is hydration. So it can get deep into internal adhesion support.
Every once in a while someone has an allergy to it, but it's quite rare. So if you're someone that you know is super sensitive and has a lot of allergies, you might want to do a spot test first. For most people, it's not considered a high allergen. So
yeah, that's great. So, and the smell isn't much of anything, which is nice.
Bit nutty, vaguely nutty, seedy.
Vaguely nutty, seedy, seedy smell. So usually we recommend using like a unbleached cotton cloth of some sort. So I often just use a hanky.
You can use a piece of a flannel sheet, like something that's cotton and has a little bit of absorbency to it.
Yeah, I went to like a thrift store and found cotton sheets, like flannel sheets, and cut them into strips. That's what I give to clients oftentimes. So, yeah. So, one thing I love about a hanky is I can get a full strip. So if I'm doing hysterectomy scars, or let's say on a knee or full chest, things like that. But you can also make it small if you just want to do, let's say, nipple graft cover. So today we're going to be talking more specifically about top surgery, because I have these scars here for you, but this applies across all scars. So yeah, so how would we?
Well, the first step is to take your fabric and pour enough oil on it to saturate. So you don't want it to be oozing and squishy, but
if you
enough
squeeze
that
it, nothing should come out.
Yeah, enough that it's thoroughly filled with oil.
It doesn't take much.
Yeah. And then you're going to put it on the area where you want it. And then often teachers will explain to saran wrap, or put a piece of saran wrap. That can be a little bit messy or crinkly to get it around your body. Is a bit of a thing if you're trying to do this regularly. You want it to be as sustainable as possible. Something Ro does is recommends a silicone baking sheet, which you can get at a lot of pharmacies or
dollar store.
Yeah, dollar store.
Yeah, reusable and washable. I like that about them.
Put that over top. So this is contacting directly with your skin, and then you have the plastic or silicone over top, and then a heat source, so a heating pad or a hot water bottle. And just put that over top and let it sit for about 10 minutes, 15 or 20 if you've got the time, and just wait.
Great time to read a book, watch a show, listen to a thing while you meditate, you know.
That time really helps. The heat helps it to sink further into the tissue, the oil. When you're done, you can take it off. You can keep a Ziploc bag and put the cloth in it and then reuse it the next time you want it. They last a while. It's a pretty stable oil. It doesn't go rancid very quickly, so you can get a bit of mileage out of it, so you don't need to throw away the cloth and use as much oil. The next time, just add a bit more oil to counteract what was absorbed by your skin. And then you can just rub the oil right into the skin. It's great. It's very hydrating, so if there's extra, just wipe it off. But first you can rub it into the scar, and that will be helpful too. And then you get the extra heat and movement of the massage, which helps the oil penetrate even further.
Nice. Yeah.
And add?
Let's see. I recommend for folks, if you're, let's say, you've had surgery minimum of 6 weeks out, I would usually say closer to 8, depending. It just, when you're sure that everything is fully healed, then you can do it, 2, even 3 times a week is great. if, let's say, like I had a piercing in my nipple before my surgery, so I had scar tissue already in my nipple, and then they're going to reshape that nipple and put it back on. So what I didn't know before that I recommend to people now if they've had piercings and they're about to have surgery is to do this in advance of your surgery, to soften that scar tissue from the piercings. So leading up a couple months, certainly a couple weeks before, regularly doing it, and then we'll do another video about scar massage to soften that tissue so it's easier for your surgeon to work with, and so it's less likely to have scar tissue that is now re-destabilized and reaching once again to grasp a hold of whatever it can for safety. So
yeah, a couple more things with the waiting time. The importance of that is that the way that castor oil works when you're doing that deep penetration especially is that it is really softening for scar tissue, which is great over the long term. It's not great when the tissue is still forming. So you want to make sure things are fully closed, no question about it, before you're doing any softening, because we do need to let it bind itself first before it can be worked with. The other thing is that there's no too late. So you can work, you can castor pack scars that are decades old. We've seen really amazing impacts of even just a little bit of massage, castor oil, castor packing on very old scars.
yeah, it's kind of amazing. So that's beautiful.
Also, if you like, you can work this into whatever kind of practice feels supportive for you. If that's a moment to be present with your body, if it's a moment to
Or not.
Note down your healing process and medications you're taking and do your kind of journaling or tracking. If it's just a moment to peace out and watch a show, that's great. But if it's helpful for you to use that time as a marker, like I have these 10 minutes or these 15 minutes to couple over this other practice I want to be doing, you can also include that as well.
Yeah, I think the biggest thing when creating a habit like this is, what do I need to put in place to make me want to do it? So if you're wanting to do this practice for your body, then checking in with yourself. What's going to make this as easy as possible for me to build this into a habit? What can I habit stack it with of something I'm already doing? Often I talk to clients about, oh, before you go to bed at night, you watch this show. That's a great time to set yourself up for your scar care while you're doing this other thing. Either before, after, during, maybe, oh, I get to watch the show because I've done my scar care. And maybe, oh, I get to do the scar care while I watch the show, How do you need to frame it for you so that you want to do it?
Mm-hmm.
So,
yeah, it can also be an interesting in-between point for people that are struggling. If you have scars that are hard for you to touch, maybe there's an emotional connection, maybe the lack of sensation is hard. Castor oil packing can be a way to care for that part of your body and connect in some way without pushing through that boundary of not being ready to work with the scar directly with your hands. You might also seek out an accountability buddy, someone that you just text like, did my scar care packing, and they send an emoji back, and you have someone that you can share that with that helps you celebrate your self-care.
yeah. I think that's the bulk of it. So if you've got questions, we love to hear them. So feel free to reach out, leave a comment, direct message, all the things. We're here for it. So, all right. Bye, y'all.